In this video, we're going to be talking about what it means when you have an eye turn, whether it goes in, it goes out, it goes up, it goes down, it goes any number of directions. So, what is an eye turn, also officially known as strabismus? Strabismus is an abnormal alignment of the eyes. It's also sometimes known as a squint. So, what does that exactly mean, and what can it look like for you? The types of eye turns you can experience are known by the following. The first one we'll talk about is esotropia. This just means one eye turns inward towards your nose. The other one is known as exotropia, when one eye turns out towards your ear. It can be right or left, it doesn't matter. You can also have what's known as a hypertropia, which means one eye turns up just a little bit towards the ceiling, towards the sky. You can also have another one known as a hypotropia, which means that the one eye is turning down, or both eyes can turn down, but usually it's just one eye that we refer to in this. We like to ask the questions a lot of time when the eye is turning a certain direction. When did it start? How long has it been going on for? Any new health history issues? Any concerns? Weird double vision? Any traumatic brain injuries? Strokes? Anything of that nature? Or is this kind of a newer issue we're seeing in a younger patient, like a child, for example, as their visual system is growing and developing? Are we seeing a concern with one eye turning in, turning out, turning up, or turning down? Sometimes the eye turns can be related to what's known as accommodation, which someone's eyes means that they move inward just a little bit in order to focus and read something up close. This can be known as accommodative esotropia, accommodative exotropia, where one eye turns in maybe just a little too much when they're trying to look at something up close, or one eye kicks out whenever they're trying to look at something up close. You focus in, you look at something, then bam, one eye just kicks out. It can be known by those following things. You can also have an intermittent one, or an intermittent esotropia or exotropia. It just means that sometimes one eye turns in occasionally or turns out occasionally. We're going to go through a laundry list of some potential causes and suspicions that we see sometimes when it comes to strabismus. They can include the following: uncorrected refractive errors, poor vision in one eye, potentially cerebral palsy, Down syndrome, hydrocephalus, brain tumors, even a stroke, head injuries, which can damage certain nerves responsible for certain eye muscles turning certain directions, neurological problems and conditions, even Graves' disease. But you can also have this for a variety of unknown reasons, or just prescription error differences, one eye being massively different compared to the other, which sometimes when that happens, you can have the condition known as amblyopia on top of strabismus. Now, what is amblyopia? Impaired or dim vision without an actual identifiable pathological or physical cause that we can observe in the examination process, meaning that one eye is not seeing as well as the other for some reason, but we can't explain why that is. Maybe it is due to a prescription thing. Maybe it's unknown for why that's happening. Some of the eye turn stuff, though, can be very genetic in a lot of ways. And some of the amblyopia stuff can be very genetic in a lot of ways. These conditions don't always happen together. They can happen separately, but sometimes they can happen together, which is why we like to check on this to make sure that we run through all the case history, that cross the T's and dot the I's to make sure that we get all the questions we need answered before we start treatment. Because what can you do for an eye turn? Eye turns can happen as early as 3 years old or even 6 months old for that matter. It varies wildly between patients of younger ages. Sometimes you can even have what's known as a pseudostrabismus, meaning that when a child is still very young and they still have kind of the baby fat around their eyes, kind of towards their nose a little bit, sometimes it protrudes out just a little bit, giving the false impression that the child may actually be having an eye turn. This is very common, and we see this a lot of times. Once we diagnose strabismus and evaluate what direction the eye is turning, what can we do about it? Well, there's a variety of things we can do. We can start with eyeglasses or contact lenses for treatment, just to see if we can get the eye to line up and cooperate with us. We can also do what's known as prism lenses, meaning it's a certain direction in the prescription that optometrists or ophthalmologists can prescribe to see how it helps the eye align a little bit better. It's very unusual stuff, but it does work when it's actually there. Or you can do eye exercises known as orthoptics or vision therapy. You can also implement the style of medications such as eye drops or ointments, meaning that there are some high-powered eye drops that kind of freeze the eye's focusing system. But it dilates the pupil, but it can kind of help straighten things out. You can also do eye patching, which means that you literally are patching the better seeing eye and allowing the worser or the more eye-turned eye or the weaker eye to gain a little bit more strength and actually kind of strengthen that muscle and that nerve pathway connection. You can also even consider eye muscle surgery, which would obviously be performed by a surgeon. A lot of children and younger patients may outgrow this, but a temporary window of treatment may need to be initiated to get them seeing their best. Because otherwise, you can have a lazy eye that follows them into adulthood, blurry vision, eye strain, fatigue, headaches, double vision, poor three-dimensional stereoscopic vision, and potentially a low self-esteem because the child may get made fun of in their early youth, which is always terrible, but this is the reality that we walk through a lot of times with patients. Strabismus is a very real condition. Amblyopia is a very real condition, both of which together can be kind of a double whammy, but they can also happen individually as well too. And there's things that we need to do in order to be able to help the patient not have that eye turn or be able to help them see better in a window that we can do something about. So with all these different conditions, strabismus, amblyopia, exotropia, esotropia, hypertropia, hypotropia, do you know which one of these that one of our former presidents, Abraham Lincoln, had? It was a left hypertrophy. If you kind of look at this picture of him that we're going to show you in a few moments, you're going to see that the left eye drifts up just a little bit. And that term is officially known as strabismus now, but at the time, it was known as a lazy eye more broadly and generically, but now we coin it as strabismus. So there's your fun fact for the day. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for more notifications. I'm Dr. Bryce Heffington, and we'll see you next time.